Hi everybody, it's Dr. Cary Yurkiw here. Thank you for joining me for tonight's webinar called How to Choose the Right Chiropractor for Your Needs. And this is part of our Dinner with the Doctor series. This series is on 7 p.m. on Tuesdays and Thursdays, and it's part of the educational series that I do here in the clinic. This topic I haven't done before because we've had some interest lately from different people, and they wanted to know how do they choose a chiropractor. For example, today I got a call from one of my patients who sees me in the summer, and he lives in Saskatchewan, and he really liked the technique that I was using on his back. I was doing chiropractic care, but also doing shockwave therapy, and he wanted to know who he should choose in his area that could do a similar type of work. And so I did some research for him. I called around to a couple clinics, and I found a chiropractor who does shockwave therapy in his area. So tonight I'm going to talk to you about how to choose the right chiropractor for your needs, and it's going to be based on referrals that I do here in the clinic to other health professionals. Again, I apologize about the noise, but they're doing some flooring in the hallway. We had a flood last December on the other side of the building, and they've got to replace the floor, so that's what they're working on tonight. I'm the chiropractor here at Tut Street Family Chiropractic in Kelowna, and I've been practicing now for 30 years. And I own the clinic here at Tut Street, on Tut Street, and I started my own clinic back in May last year, 2023, and this is our 1-year anniversary. We just came up on our 1-year anniversary, and my journey into chiropractic began when I had a lot of knee pain, and that knee pain was in my early teenage years. I really struggled with the pain, especially when I was playing sports like hockey or in the field, doing activities with my friends or doing things like Ukrainian dancing. I had a lot of pain in my knees, and I went to the family doctor, and he said it's just growing pains and I would grow out of it, but it continued. It persisted over a 2-year period. And finally my father said he heard of a chiropractor that was going to our church, and he would take me there to get an assessment. And when I went there, the chiropractor did a history, he examined my knees, did some x-rays, and found out what the cause of my pain was. And that made a big difference because he applied the right treatment for me. It worked, it changed the way my knees functioned, got rid of the pain, and over a few months, my knees completely healed, and I was able to play hockey at a higher level, do other activities that I really enjoyed. So that's how I got started with chiropractic, and kind of made the decision when I was a teenager that I wanted to become a chiropractor myself. So I'm excited to provide information about the clinic today and how to choose a chiropractic clinic in your area. I wanted to define some of the chiropractic principles that we provide here in the clinic, as well as what you should look for if you're looking for a chiropractor in your area. So why does choosing the right chiropractor matter? Well, you want somebody who's going to personalize the care for your needs. So somebody who's going to understand your problem, somebody who's going to know how to treat that problem, and somebody who's going to give you good advice going forward so you can manage your health and have a good long-term outcome. So we want to see improved long-term outcomes for our patients, and part of that is just finding a good fit. So you want that comfort with the health professional. You also want the trust that comes along with it. So why a poor choice can lead to a poor outcome is because if there's not a good rapport with the clinic, if you're not getting the results that you're looking for, if you don't have the direction of treatment that you want, can lead to a poor outcome. And sometimes I hear patients they come to the clinic and they'll say something like, I tried chiropractic before, but it didn't work for me. Or I went once or twice, but I didn't notice any results. And sometimes I think it's because the clinic really didn't assess the person and lay out a plan going forward for them. So what I do here in this clinic is I do my initial assessment and treatment on the first visit. On the second visit, I give the patient an update on what I'm finding out, explain to them a little bit more about how I practice and what's worked for their condition in the past. And by the third visit, I'm generally giving them results on how the pace of healing is going, what the care plan should be going forward, and my specific recommendations for them, their condition, as well as that person, because some people heal faster than others, and it's very important that we adjust our care plans based on the patient's needs. So one person with a lumbar disc situation or injury can heal faster than another person with a similar condition. And that's all based on the lifestyle and the previous history and a whole bunch of different factors that you need to consider when you get to see a new client or a new patient. Okay, so now some key factors to consider when you're choosing a chiropractor. Credentials are important and experience. So what training did they get? What additional training did they receive? Did they take any seminars to update their skills? And the experience that they have with your specific condition. So you definitely want to find out more. You can research the clinic online. You can look at reviews. You can also call the clinic, and most clinics will do a consultation, whether you have to pay for it or it's a free consult. It's a good idea to just get to know the clinic a little bit before you commit to treatment. You want to find out what techniques and specializations the doctor and the clinic have. I'll talk to you a little bit more about what we do here today, but every clinic's a little bit different because of the techniques that they use and the specializations. And we have a number of different techniques in chiropractic, so just finding a good fit is important. And then the patient reviews and testimonials, you can go online and look at Google. That's always a good place to look, but also places like RateMD's very effective at seeing how patients rate that chiropractor. Then doing a consultation is important because you get to meet the chiropractor, you meet their staff, you meet the clinic, you get a feeling for the clinic, and you can prepare some questions that you might have for the chiropractor, like how do the treatments work, how do they feel, what instruments or techniques would they use, and how do the treatment plans work, what are the costs for the services. So all of those things are going to be very important. Do they bill directly to insurance? So there's so many variables that basically you want to find out before you start treatment, so there's no surprises. And we try to lay that out as best as we can with the patient right from the beginning. And then, like I said earlier, giving the patient some updates on the second and third visits so they know which direction they're going in for the future. And then, of course, giving consent. So giving consent for certain types of treatments, giving consent for any kind of modalities that are being used, whether they're shockwave or laser or orthotics. That's very important too. So just having that discussion about what you can expect from the care, any side effects, any contraindications based on your history or some of the procedures you've had in the past. All very important discussions to have with the chiropractor that you choose. Then understanding various techniques. So some of the techniques you want to understand are, do they use hands-on adjustments? Do they use instruments? Do they use tables? Are there other modalities that they use? What are the results of those modalities with the patient's specific condition? And then what's the evidence behind that as far as the outcome goes? So it's very important that you ask those questions, you learn more about this, and that way you can feel more comfortable with the treatment and know what to expect going forward. In our clinic, we use hands-on and instrument adjustments. So we incorporate different techniques into the treatments that can involve some instruments like the Y strap to decompress the spine, depending on the condition. And the instruments, we have two different types. We have an activator. I actually have it right here in front of me. So we use an activator like this to do adjustments. So we can calibrate the tool with a certain amount of force and then do the adjustment. And that works for the spine, but it also works for the joints as well. Knees, ankles, wrists, ribs, very specific adjustment instrument to do adjustments. We have another instrument called an integrator. It works with torque release techniques, and it actually does some impulse and a turn or a twist to the adjustment. And that's to realign and to release tension along the spine so the spine can normalize. So we use activator, integrator. I use tables to do adjustments. These are, the technical word for that is the Thompson technique. So we use the Thompson technique to do adjustments as well. And then we use the Y strap to decompress the spine. And for some of our patients, we use shockwave and laser. So I'm gonna go over that with you. And I think I mentioned hands-on, maybe I didn't, but the traditional type of chiropractic care is the hands-on, we call it SMT, spinal manipulative therapy, or adjustments. And just doing those adjustments, that's kind of old school chiropractic, how it all started. Hands-on adjustments to realign the posture, the spine, the joints in the body. Sometimes there's a popping noise when we do those adjustments, but they're very effective to provide relief, realignment, and restore function in the body as well. We do shockwave and laser, and the patient I referred to the chiropractor today, close to him in Saskatchewan, was for shockwave. So shockwave is a non-invasive treatment that utilizes acoustic waves to stimulate the body's natural healing process. So shockwave is very effective to break down scar tissue, to bring better blood flow into the area, to heal old injuries, to promote speedy recovery from soft tissue and joint injuries. And then also we use laser therapy, and that's light therapy. So shockwave is acoustic waves, laser is light therapy, and that is done to administer concentrated light into the body. That light stimulates the mitochondria, the energy producing part of the cells, and when they're stimulated, it releases chemicals to help heal the tissue and speed up recovery. So sometimes I'll use shockwave and laser interchangeably. So I'll start off the patient with, let's say, some adjustments, which we just reviewed, and then I'll do shockwave on one session and laser on the next to see which one works better for that patient. Then I generally stick with that one technique going forward. Something else we do in the clinic are orthotics and orthopedic shoes. I've been doing that for 20 years, and we've been very successful at doing an assessment of the feet, the gait pattern, the way the person walks, looking for any wear patterns on the feet, on the shoes, and then doing a cast of the person's foot in a foam impression kit, and then getting orthotics ordered that correct the alignment of the foot, pronation, supination, cushion the foot for heel spurs, plantar fasciitis, or even like metatarsal arch problems or metatarsalgia. So we do this to support the right alignment of the foot, give the patient better shoe wear, as well as take the pressure off the ankles, the knees, the hips, and the spine. So orthotics and orthopedic shoes, another service we offer in the clinic, and usually the coverage for that is over and above chiropractic care. So you have a certain amount per year for chiropractic and a certain amount per year for orthotics and orthopedic shoes. Something else I offer and we do is health coaching. I think as the problem is getting better, patients feeling better, the patient's doing some exercises, stretching, strengthening, and making some lifestyle changes, the health coaching really helps because we educate our patients that way, and then there's some accountability when we follow up with the patient to see how they did with the recommendations that we made. So this is more empowering for the patient, gives them some accountability, gives them some added value and direction going forward to manage their own health better. Now, to prepare for your first visit, what we do is a health history, and you fill out documentation. Then we're going to talk about goal setting. What do you want to achieve with the treatment? And then last, follow-up questions that we want to ask the patient, or the patient wants to ask us. So it's a bit of a informative session on that first visit, and I encourage people to ask questions, to come prepared with some questions so that they can feel comfortable with the care. Now, speaking of questions, do you have any questions? I'm just going to type in the chat here on YouTube. So do you have any questions? And on Instagram, if you do, I'll just be watching for the comments and see if you have any questions and answer those for you. I will check on the on our profile later today and tomorrow just to see if you DM any questions or comment. Similarly here on YouTube, I will check in tomorrow and the next day to see if there's any questions from people watching the repeat or the recording of this webinar. If you don't have any questions, this month we're offering 10% off for new clients. You can come to our clinic without a doctor referral, so you don't have to have a doctor referral. And we bill directly to insurance, which is a great benefit. We're open 7 days a week, including same and next day appointments for patients that are in a lot of pain and need some help. Please use this coupon code. I'll put this in the show notes, WB10%, so we know you came to the webinar, and when you book your appointment, we'll give you 10% off for the month of May, up until May 31st. So please feel free to book an appointment online. We do have some openings in the next few days, so you can go on our website and do that, and I'll put a link below in the show notes here on YouTube. There's a link in the bio above on Instagram. Now, if you're interested, our next webinar is called Relief Techniques for Neck and Shoulder Pain. It's going to be May 16th at 7 p.m. And so that's 2 weeks from today. And it's part of that Dinner with the Doctor series. And I'm going to be talking more about neck pain and shoulder pain and the connection between the two and different conditions we see in the clinic. And this will involve neck sprains, whiplash. We're going to talk about concussions. We're going to talk about shoulder pain from rotator cuff. We're going to talk about shoulder pain from AC joint sprains too. So if you have any of those conditions, this webinar is going to be for you. And to get a ticket, you can go to our Eventbrite page, and then you can click on this webinar and then get a free ticket. Now the space is limited, so I would encourage you to do that now. And you can join us in 2 weeks on May 16th at 7 p.m. I want to thank you for joining me tonight. The noise wasn't too bad. Actually, the guy stopped working in the hallway for whatever reason. And so we kind of got some peace and quiet to do the webinar. If you have any questions, like I said, you can type them here in the chat, or you can comment or DM. I hope you